Hi, good evening. Sorry for the delay in starting. We're having a small issue. One of our presenters from the US has just had a computer crash as he tried to join the call. So we're going to just give him a minute to try and join us. Um, Hopefully that's going to be absolutely fine. I'm sure it's bound to happen sometime. Just to give you some advance notice, we have another webinar coming up with Outdoor Active, and I will mention that now because I had the program from Outdoor Active sent to me today. So the Outdoor Active webinar will have a description of the partnership, how that works. It will have a description of the onboarding process and how it's possible to get a hold of a license for this product. We'll then talk about how the website version of Outdoor Active works with the various maps and the layers and so on, how you use Outdoor Active basically for planning and guiding. Then we'll have a description of the business side of the website. This is the bit that you're getting as a bonus to promote your business and to promote Wimla, of course. So this is how Outdoor Active works in the back office. And then we'll have a short preview of what is planned for the new version of the product. And that product has been a little bit delayed because there were some technical problems, and that's why some of you were aware we were getting Outdoor Active, and it took a little bit of time to actually action that delivery. I do want to say again and again that you'll get the license code from your national association. So I realize it's frustrating if you can't get hold of those, but there's very little that Wimla can do about it other than continually inform the national associations that they should do something about this. So I'm pleased to say that Jeff's joined us now. Right away, I'm going to hand over to Marianne, who is the Vice President of Wimla, and Marianne has been running this project with risk management, and he'll tell you all about it now.
Hi, everybody. My name is Marian Angel, and I'm the Vice President of Wimla, as Ian said. How this idea of risk management now with Wimla, I work in the mountains by more than 20 years, and I see risk management as a cornerstone of responsible mountain activities. It's about the nature of mountain environments combined with human and technical factors. And yeah, this requires a proactive and multifaceted approach. And when we talk about risk management in the mountains, professional or just mountain lovers, we know that it's not about eliminating risks. This is impossible in such kind of environments. Instead, it's about understanding, minimizing, and managing risks to ensure the safety and the success of every adventure. A dedicated training course in risk management is essential for professionals and serious enthusiasts involved in mountain activities. And we know that mountains are unpredictable, and all the activities we do in the mountains are unpredictable. And a structured training course gives us individuals skills and knowledge which we need to make informed decisions, to respond effectively to emergencies, and to minimize the risk. In my opinion, a dedicated course is not just an option, but it is a responsibility for us as professionals and for all of those involved in mountain activities. 2 years ago, I think, I discovered Veristar courses, and I joined one of them just as a normal student. And during those 40 hours of training, I saw how Jeff works in general, how he prepared this course. And I saw what Veristar does in general, different activities, and I really enjoyed. And soon after that, talking with Jeff, came the idea why shouldn't we do something together with Wimla? And yeah, why not? So since then, we spoke a lot, we talk a lot, and we made some kind of paperwork, and finally we're here, our first time. So here is Jeff. Jeff, I think you should come in front and take the microphone.
Great. Well, thank you very much, and it's a pleasure to be here, everybody, and to share some thoughts about risk management in the mountains with you. I'm going to share my screen here so that hopefully you can see this presentation. And let's see. Okay, could you give me a thumbs up if you can see a picture of the mountains and a slide that says risk management in the mountains? Marian, I can see
That's
you.
perfect.
Okay, that's great. Wonderful. And if you would like to see this slide presentation as well, or even download it, I'll put a link to the copy of a PDF copy of the PowerPoint slides so you have access to them there. So, and again, I apologize for my delay in joining the webinar here. We had some technical difficulties. Okay, so I'm pleased to share some ideas about risk management in the mountains with you. And what I'm hoping to cover in the next slightly less than 90 minutes here, as you can see on your screen, is a little bit of the academic research about safety across all kinds of industries, from mountain leading to aviation, healthcare, and elsewhere. And we'll talk about the risk domains model for supporting good safety outcomes. We'll take a short break and then we'll talk about risk management instruments, which are also part of this risk domains model. These are broad-based tools to support good safety. And then we'll have some moments perhaps at the end for any comments or questions. And just by way of background, I've been working as a mountain leading professional since 1987, leading backpacking and trekking trips, and then starting leading technical mountaineering and related expeditions. I've been involved in the mountains for work or play in a number of countries, about a dozen countries, from Switzerland to Iceland and Japan and Peru. And currently I'm with a consulting and training firm, Veerstar, where I work as a consultant and trainer and expert witness in outdoor safety. Before we head into the mountains, I'd like to take us to this beautiful lake in the southwest of England, Rodeford Lake, where there's an activity center that provides lake-based activities. And this activity center has a wheelie boat, so-called, which is a specially outfitted boat where wheelchairs can wheel on and then people can travel around the lake. And a few years ago, a care center or a nursing home nearby rented out this boat from the activity center so that Alex Wood and Allie Tilsley could go on about a 40-minute tour around the lake. And they, due to their medical conditions, they're strapped into their motorized wheelchairs. And as the boat was traversing the lake, the boat capsized, and Allie and Alex, who were strapped into their heavy motorized wheelchairs, were dragged to the bottom of the lake and tragically drowned. Because this was a water-based incident in the UK, the Marine Accident Investigation Branch investigated this incident, and they wrote up a report. And some of the highlights from the report indicated that if we're going to prevent similar incidents in the future, a change to the laws around adventure and outdoor safety in the UK may be required. The investigators noted that there was no organization, no national governing body in the UK that oversaw safety and quality for outdoor adventures of this type, renting out motorboats. And that although there was an organization, the RYA, or Royal Yachting Association, that did accredit water-based adventure and activity centers, such as this activity center, there was a loophole in that scheme where motorized boat rental was not covered by that accreditation scheme. The organization, which had a multi-million-dollar-pound budget and had been active for decades, had an active safety committee that had meetings and kept minutes and did risk assessments and was quite active, but that safety committee was ineffective in understanding some of the chronic safety problems that had gone unresolved at the organization and led to this tragedy occurring. The investigators found that the organization failed to do appropriate medical screening and that there was important safety documentation, such as the owner's manual for the boat and the safety placard on the boat, that was missing, and the activity center failed to fix those issues. The investigators also found that there was poor oversight of the contractor with the care home, failing to evaluate whether the activity provider was able to accommodate wheelchair users appropriately. The organization did have an emergency plan, but it was found to be ineffective. And even though the organization had gone through safety audits, those had been ineffective in identifying some of the safety problems that led to this incident. You will note in this list of findings from the UK government that one of the criticisms that's missing is criticisms of the actual activity leader themselves, the boat operator who was driving the boat. The government looked and said, if we want to prevent this incident from recurring or a similar incident, we need to act at the level of government and industry associations, national governing bodies, and the administration and managerial actions of the organization. And we'll come back to that theme about levels of the system in which are important to support safety. So what can we learn from this incident, and how does understanding the analysis of this incident inform us in supporting good safety outcomes in the mountains? Well, let's go back a couple hundred years and think about the question, why do incidents occur? And back in the 1800s, in the heart of the Industrial Revolution, there was a mechanized view of incident causation, where people were seen as cogs in an industrial machine, and there was a linear model of incident causation, where there was a precipitating event, a chain reaction of items, and then there was the actual harm itself. This is a very simplistic, not very helpful model, but it was the best thinking back 100, 200 years ago. Time passes and people recognize that when there is a serious safety incident, often people are involved. So to prevent incidents, all we need to do is to control the actions of people. And this is the advent of what's called rules-based safety, where there are employee handbooks and SOPs, standardized operating procedures, and field manuals, and all kinds of rules and policies and procedures. Well, time passes. In the 1980s, there's an increased recognition that, you know what? When we tell people what to do, they don't always actually follow the rules. And there's not one set of rules that's going to be applicable to every safety situation, every circumstance, every emergency. So it's important to give people operating procedures, because these are helpful predetermined guidelines about what's likely to be the best way to proceed to prevent an incident from happening or to respond to an emergency. But we also need to explicitly, in writing and verbally, repeatedly tell people it's okay not to follow those rules if, in your good judgment, it is safer to not do so. And so this is the onset of what's called integrated safety management, providing rules and guidelines and best practices, but also explicitly permitting and encouraging people not to follow those if, in their good judgment, in the unique circumstances that they find themselves, it is more appropriate to do something else. And then in the 1990s, the next era in safety thinking emerged, and this is the systems era, or the use of systems thinking and the understanding of lead outdoor activities in the mountains or elsewhere as a complex socio-technical system involving people and things. And the idea here is that we may not understand all the different risk factors that are happening, and we may not understand, when a major incident occurs, it's often because of a combination of risk factors that come together in a way we can't anticipate in advance at a time that we won't know what it is in advance to lead to an incident. So to support good safety outcomes, it's important for us to build a resilient, multi-layered safety system where we recognize that failure of the safety system in one component is inevitable. But if we've employed resilience engineering to build a safety system characterized by redundancy and additional capacity, that inevitable failure of one element in the system does not lead to a catastrophic outcome like a permanently disabling injury or a fatality. So let's walk through in a little greater detail some of the thinking over the last 100 years of how incidents occur and thereby how that might be prevented. In 1931, Herbert Heinrich published an influential, at the time, textbook called Industrial Accident Prevention. It went to 5 printings, and he said there's a series of events that or elements that lead to an incident. So to stop harms from occurring, all we need to do is remove one element of this chain reaction, and we can stop an incident from occurring. This is considered today not very sophisticated and not very effective, but it was the best thinking about 100 years ago. Moving forward, the Ishikawa diagram, or the fault tree analysis, or fishbone diagram, was developed, and this saw multiple elements that could contribute to an incident's occurrence. Why did the hikers slip and injure their ankle? Well, the staff person was not paying attention to who was doing well and who was struggling on the trail. There was a safety culture of let's go, keep going, and don't take breaks or ask for help if you're struggling a little bit. The trail was slippery and poorly maintained, and the equipment was an issue because the person didn't have appropriately fitting hiking boots. And so all those multiple contributing factors led to the incident. Moving forward, in 1990, James Reason published an influential article about incident causation, and his ideas were popularized as the Swiss cheese model. And the idea here is that you create barriers and defenses, and that an incident only occurs when a hazard is able to get through or over or around all those barriers and defenses. In addition, Reason said that there are latent causes. For example, in our context, this might be a poor safety culture of bravado and machismo and don't admit weakness or fear. And then there's a precipitating event for perhaps a medical incident or severe weather. And so latent conditions and events combine to lead to an incident. So this is not considered the most current sophisticated thinking, but it is the very first systems-informed model. The most contemporary, sophisticated, and effective models of how incidents occur incorporate complex socio-technical systems theory. And this is the most useful, but also the most abstract and difficult to understand model of incident causation. And in a complex system, we have multiple risk factors that may combine in ways that we may not anticipate in advance to lead to an incident. We may not know exactly what all those risk factors are. Risk factors are always coming and going. We may not have control over all those risk factors. When we try to intervene in the system, there may be unintended consequences, and the system is always changing. And examples of complex systems where identifying and resolving issues are really challenging include the global climate emergency, issues of inequity and exclusion in society, and also mountain leading and led outdoor activities. How do we respond to the challenge of preventing incidents in a complex system? The Danish researcher Jens Rasmussen was hired to work on nuclear power plant safety in Scandinavia, and he came up with a model called AXIMAP that's probably the most widely used model in industries from power generation to aviation, healthcare, and beyond around the world. And Rasmussen said, if you want to prevent incidents, you have to act at all levels of the system. It's important for government to pass safety laws and regulation. It's important for associations to develop standards and internal regulations around good practice. It's important for operators or companies to establish safety policies. It's important for administrators at those companies to create safety appropriate plans. And then staff who are actually doing the direct service, it's important for them to perform their work actions appropriately. And the work actions themselves should be designed to minimize inherent risk. There's another model that was developed specifically for the outdoor adventure, travel, and experiential context, and that's the risk domains model. And in this model, we see that there are 8 direct risk domains where risks reside: culture, activities and program areas, staff, and so on, where staff might be inappropriately trained or equipment might malfunction, participants might not follow safety directions, and so on. These are domains where risks reside that can directly lead to an incident. And there are also, in fuchsia at the top of this diagram, indirect or underlying risk domains that we as activity leaders or organizational managers may not have control over or be able to directly influence, but can support good safety outcomes depending on how they're constructed. For example, if government has good safety laws or the outdoor sector has created qualification schemes and standards, those can support good safety outcomes in an organization or an excursion. Let's take a little bit deeper of a look at this risk domains model. The idea with this risk domains model is that an organization can look at itself with respect to each of these risk domains and assess, do I have any risks in any of these risk domains? And then the organization can institute policies and procedures and values and systems to reduce risks in those risk domains so far as is reasonably practicable. In addition, the model has what we call risk management instruments, and these are broad-based tools that can reduce risks across multiple or all risk domains at once. For example, risk transfer includes liability insurance, and medical screening involves ensuring that participants and staff are medically well-suited for activities. So let's take a deeper look at these risk domains and think about what they actually entail. And we'll start with these 8 direct risk domains. The first one is safety culture. And when we talk about culture, we mean the beliefs and values that animate behavior, which can influence safety outcomes. We can't see people's beliefs and values, but we can see the behavior that is driven by those beliefs and values. In the mountain leading context, some of the issues we might see with safety culture include financial pressures at the organization, which lead to cutting safety corners, efforts to please the client, and so to go ahead and to get to that summit, even though the weather is indicating that we really should turn back. Rather than having a proactive, vigilant approach to dynamically evaluating risks, having a check-the-box safety culture where we look at our risk assessment beginning of the day and then we don't think about safety afterwards. What the American Psychological Association calls toxic masculinity ideology, which is around bravado and machismo and failure to talk about fears or concerns or to admit vulnerability. And the idea of just culture. And in a just culture, when an incident does occur, the person who's closest to the incident isn't immediately or reflexively blamed, but the organization looks deeper at underlying causes that may have led to that incident occurring. So that's safety culture. With respect to the next risk domain, activities and program areas, managing risk here starts with selecting activities and program areas from the very beginning that have the lowest inherent risk, but also still allow organizations to meet their programmatic objectives. It's important to do risk assessments when there are new circumstances, when you're starting a new company, when you're working with a new population, providing a new activity, operating in a new area, or there are new changes such as the COVID-19 pandemic. And then one can establish standard operating procedures to manage the risks that one has identified as existing in this activities and program areas domain. While activities are happening, it's important to stay vigilant and to dynamically evaluate and manage risks as they arise or as they change. Then afterwards, it's important to talk to staff and participants and think about, hey, what worked well in terms of safety and how can we improve as well? And then to systematically follow up on the information gained from those review activities. With respect to staff, you can easily recognize that it's important to have qualified staff, or in some cases, competent staff, in some cases also qualified staff. And having qualifications or certifications or credentials is a useful indication that a person has the appropriate capacities. If there is training before or after the issue of a qualification, it's helpful to have documentation of what that training is and that a person successfully completed that training. And then you can easily understand that staff should be supervised and evaluated appropriately. And this refers to both activity leaders as well as their administrators and other support personnel such as logisticians. One of the things we think about when we're in higher risk environments like the mountains is the importance of making good safety judgments. How do we help people make good safety judgments? Well, one of the things that we recognize is that when there is a mistake made, that's usually not because of a technical deficit, but because of issues with cognitive skills or the interpersonal skills. The aviation industry has put a lot of work into this. They've come up with something called crew resource management, and this has made its way into the mountain context with people like James Thacker, who in the UK, who are providing crew resource management based training for people who are mountain professionals. And in crew resource management, or CRM, there's specific training provided around communications, staying aware of one's environment in a crisis, making alternative plans, being aware of fatigue and its negative effects, and working together with others, including in an emergency. Also, making good judgments is supported when we debrief incidents in a structured way and learn from them, and when we provide feedback, particularly to our supervisors, and there's a culture that allows us to provide constructive criticism to people who have greater power than we do. A just culture where people who are closest to the incident aren't reflexively blamed for the incident and punished, but the organization looks for underlying causes, also supports good decision making and reduction in error causation. And you'll note that a lot of this is not the purview of the actual on the ground staff person, the activity leader, but the managers and the administrators of an organization. When we think about making good decisions and avoiding errors, beyond baseline technical skills training and some other training, such as in the crew resource management topics we talked about, and getting some baseline experience, the academic research doesn't show that there's a good way to teach judgment or good decision making. And so, in order to help ensure that good judgments or good decisions are made, there are two primary approaches beyond baseline skills training and some minimum level of experience. And one of those is to structurally reduce the need to make difficult decisions in high consequence environments. And so an organization can institutionally eliminate risks, for example, driving at night when people are fatigued and there's lower visibility, by saying, for example, we're going to organize our itineraries so we don't come out of the mountains at 6 o'clock at night and have a 3-hour drive back to the activity center when we're really tired and it's dark out, but we're going to get out early and drive when we're still fresh and there's good visibility. An organization could systematically perform medical screening of potential participants to ensure that they're medically well suited for activities. In addition to structurally reducing the need to make difficult decisions, an organization can provide what are called decision aids. And this is specific guidance to help people make good decisions. Checklists are an example. Standard operating procedures that say this is what you normally should do are another example, and documented standardized safety briefings are yet a third example. Some organizations will document on a piece of paper what the contents of the safety briefing should be as we are at the trailhead and about to start hiking, for example, or before we're going to do a stream crossing. And the activity leader will walk through, will read through each of these and initial by each item in the safety briefing that they have covered it, and then they'll sign and date that, and that goes in the excursion log. So there's really good consistency around providing all the information, and there's documentation that all the relevant information has been provided. A lot of these things aim to eliminate the need for people to make the correct decision or to reduce the challenges to making the correct decision. And one of the ideas in safety science is that person-centered controls are weak. And so this brings us to what any of you who have experience in the occupational health and safety industry may recognize as safety by design, and the hierarchy of controls that's been established and promulgated by workplace health and safety authorities around the world. And the idea with the hierarchy of control is that there are more effective and less effective ways to support good safety outcomes. The most effective way to reduce a hazard is to eliminate it completely. Then you can substitute a higher hazard for a lesser hazard. You can isolate people from the hazard using engineering controls. And then as we go down, there are lesser effective tools such as administrative controls, including training and the use of SOPs or standard operating procedures. And the least effective method is use of personal protective equipment. And you can see that as you go down this hierarchy, the effectiveness decreases and the amount of residual risk increases. So the idea is that we want to take the potential for human error out of the situation. And this hierarchy of controls is actually required by law for mountain leaders who are operating commercial mountain activities in New Zealand. And so in our context, examples would be, we can remove the hazard of rope climbing as mountain leaders by not doing rope climbing at all. We can replace our wooden ice axe with a metal ice axe. When I bought my first ice axe in the early 1990s, it was metal. My father's ice axe, which is wooden, you can't use those or buy those anymore. You shouldn't use them. You can you can isolate people from the hazard of falling over a cliff by having a guardrail at a cliff top overlook. And then you can have training and SOPs and hygiene practices and warning labels and signs and debriefs. And these are relatively weak controls in the hierarchy, but these are administrative controls. And then the least effective measure is personal protective equipment, things like well-fitted hiking boots with good traction, warm jackets, sun hats for the sun, hand lines in challenging terrain, and the like. So understanding that to the extent that we can engineer out the need to make human decisions, that's associated with better safety outcomes, and that's a fundamental concept within the hierarchy of controls that can help us design safety into our programs and our excursions. So that's a bit about staff. Moving on, let's talk about risk domain number 4, which is equipment. And we want to source equipment from reputable sources, and we want to follow original equipment manufacturer instructions and industry good practice for inspection and maintenance and repair and retirement of the equipment. It's also helpful to do appropriate inventory control. So when you grab that first aid kit off the shelf, the medications are not expired and the kit is fully stocked. Participants and staff need to have appropriate training in what equipment they should have and how to use it appropriately, for example, by breaking in boots so that we don't get blisters when we go out on an excursion in the mountains. The participant risk domain involves selecting appropriate participants for our activities. Are we capable of handling people with disabilities or not, for example? Then doing appropriate medical screening of participants, and then giving information about risks and receiving informed consent to assume those risks. And then participants need appropriate education and supervision during activities. And then afterwards, it's helpful to ask them, hey, what went well in terms of safety and what could be improved? And then to systematically follow up on that feedback. I want to introduce you to Lachlan Cook, and this is a picture of Lachlan, and he went on an excursion with his school, and a third-party provider ran the expedition. Lachlan had diabetes, and during the expedition, he had a diabetic emergency, ketoacidosis, and the staff on the trip didn't understand what diabetic ketoacidosis was. They didn't recognize it, and Lachlan fell into a coma and he died. In the coronial inquest that followed in Australia, the coroner found that the death was preventable. So understanding people's medical conditions and making sure that you have their asthma action plan, that you understand how to refill the cartridge in their insulin pump and when to detach the insulin pump from a person who's diabetic. If you have someone with asthma, understanding to ask for their asthma action plan and how to manage an asthma action plan and so on. All these are helpful tools to support good safety outcomes in the participants' risk domain. With providers or contractors or suppliers or subcontractors, third-party providers and vendors, before we hire them, we want to evaluate, is it suitable to use this particular vendor? Now, this is tricky for us in real life because often we say, well, we've been using these folks for 20 years. We're sure they're fine. They have had a great safety record. Why bother to check? Or we might be in a hurry. Maybe a friend recommends a provider to us, and so we don't do a whole lot of checking. But it's important to evaluate, is this entity suitable for us? And you can see on your screen a sample questionnaire that can be used to evaluate a provider's staff qualifications and equipment management practices, emergency procedures, insurance coverage, and other items. A lot of provider selection has to do with activity providers, but sometimes we're looking at providers that are providing transportation or food service or accommodation, and accommodation brings with it its own risks as well. This is a picture on the screen here of a hut in the Alps that was used by people who are traveling in the Italian Alps, and probably due to climate change, it collapsed and fell down off the mountain a few years ago. In the transportation risk domain, number 7 out of 8, transportation is considered a relatively high risk activity. You have large objects, heavy objects moving at high speed. There's a lot of force involved. It's important for motor vehicle operators, whether they're yours or third-party providers, to be appropriately qualified and to have passed cognitive and on-the-road practical tests and to have appropriate motor vehicle record. There should be operating procedures for vehicles for standard operations as well as for emergency procedures. And occupants should get guidance about not sticking their arms and legs out the window, for example, if it's a group of children that you're taking out on a trip. And then there are administrative practices around documenting and appropriately conducting inspections and maintenance and repairs and retirement. And even just a little lapse of attention can have some negative consequences when conducting motor vehicle operations. So it's important to pay attention to good transportation risk management. The last direct risk domain is business administration. And this is really about enterprise risk management, about protecting the mountain leading organization and its reputation and its corporate goodwill and so on. And business administration includes things like facilities safety. Do we have signs over the exit doors, and are the exit doors unobstructed in case there's a fire? Do we have fire extinguishers and so on? And then also protection of data like people's credit card numbers and their confidential medical information. And then there are strategic risks beyond these immediate risks. At Veristar, the outdoor consulting and training company I'm with, we work with organizations around the world, including a number of organizations in Lebanon, including an organization that is building a trail network in the mountains of Lebanon and taking people out on those trails. And due to geopolitical concerns, it is a difficult time to be a mountain leader in Lebanon, and it is a difficult time period in Lebanon. So this is something that that may be important for people in certain circumstances to think about. The other strategic risk to be aware of is the global climate emergency. And there are increasing floods and fires and glacier collapses and other hazards in the natural environment, in the built environment, due to the global climate crisis. I ran for several years an outdoor adventure center in the USA, and this picture here in the bottom right corner of the screen is a picture of our office a few days after it burned to the ground in a wildfire that was made more likely due to climate change. And 35 years of paper records of all our participants and our programs were incinerated in the fire, and staff housing for about 24 employees was burned down to the ground, along with all their personal possessions they didn't have on their person at the time. And we can expect hazards from climate change to increase throughout our lifetimes. So that's a quick review of risks and their management within these 8 direct risk domains that we often have a lot of influence over. I want to briefly talk about the 4 underlying or indirect risk domains and how they can support good safety outcomes in the mountain. We'll start with government, and government has a really important role in supporting safety, primarily by passing safety-oriented laws and regulations, including around adventure activities, as has happened in Switzerland and the UK and in New Zealand and elsewhere. Government can also develop approved codes of practice for certain outdoor activities like mountain leading and trekking. And approved codes of practice provide special legal protections generally to mountain leaders and their organizations, where, for example, in the UK, there's a provider who's providing adventure activities and they follow the UK's approved code of practice for adventure activities, they cannot be found liable for negligence for those activities described in that approved code of practice if they have followed those guidelines. So approved codes of practice provide really important information as well as legal protection for mountain leading and other adventure and outdoor organizations. Government can also provide funding and logistical or operational support to outdoor industry bodies to develop standards, to write good practice guides, to develop training schemes and the like as well. So government has an important role to play in supporting good safety outcomes. Society and business refers to a society that values safety and well-being. So if there's an incident, it gets in the newspaper and there's a lot of publicity around it, that's more likely to propel people to pay attention to safety. And with respect to big business, if corporations have a sense of corporate citizenship and don't inappropriately degrade the ability of government to establish and to appropriately enforce common sense safety regulations, then that can support good safety outcomes across many industries. And then the last indirect risk domain here is the outdoor industry. And there are a few different players in the outdoor industry associations like UIMLA and avalanche associations, for example, sports councils, particularly in the United Kingdom, and then national governing bodies or peak bodies in the UK. Mountain Training is one of those. And these entities have a number of roles. They can offer accreditation schemes where they recognize that outdoor organizations have met certain safety or quality standards. They can provide training schemes and training centers. You can see here a picture of the Adventure Tourism School in Gudari in the Caucasus Mountains in Georgia, where mountain leaders and mountain guides receive training for mountain activities in Eastern Europe. Activity leader qualifications like the UIMLA Carnet, and then the outdoor bodies can develop good practice guidelines and standards and activity safety guidelines that provide detailed guidance to operators about what is expected and widely accepted industry good practice. In some countries like the UK, there's a well-developed outdoor sector with many industry bodies and governing bodies. In other places, this picture here is a picture of an outdoor trip in Zimbabwe. Zimbabwe has some room for growth with the development of industry associations and bodies in its mountain leading and its outdoor sector in general. To summarize a few thoughts about supporting good safety outcomes with respect to these risk domains, we can recognize that the academic research around safety suggests that the highest probability of positive safety outcomes comes when government has appropriately developed and appropriately enforced safety laws, including adventure safety regulations, and has developed approved codes of practice which provide detailed guidance. And then industry bodies, including associations, provide accreditation for organizations to indicate that they meet quality and safety standards, and they provide qualification or certification schemes to individual practitioners, and then training schemes and centers to deliver that training. And when industry, the private sector also develops good practice guidelines that provide detailed and specific guidance about how specific activities can be conducted. And generally speaking, things work best in regions where the government and the private sector collaborate effectively to support the development of all this safety infrastructure, with government financial support for developing approved codes of practice, good practice guides and standards and the like in the form of money and logistical support. And some countries like Australia and Singapore have done a really good job with a teamwork approach with government and the private sector in the outdoor and adventure industry coming together to support the development of safety supports for the outdoor industry. Okay, so that is a very brief outline to these 8 direct risk domains and the 4 underlying risk domains and approaches to understanding and managing risks in these risk domains. I've been talking for a long time here. We're going to take a 5-minute break so you can get up and move around in just a moment. And as we do, I'd like to invite you to consider this question with respect to your mountain leading organization. To what extent do you feel that you have identified all the existing risks and all the relevant risk domains that exist for your organization? And to what extent do you feel you have instituted policies, procedures, values, and systems to reduce those risks so far as is reasonably practicable? We have a couple comments that have come through the chat as well about taking clients on difficult terrain. There's not a lot of choice about footwear. That certainly is a challenge. I agree. And then sharing and demonstrating foot placement can be useful as well. So thank you for those thoughts. Okay, so we will take a short 5-minute break here, and we'll come back. And when we rejoin, we will talk about risk management instruments. Thanks, everyone, and we'll see you in 5 minutes. Okay, well, let's get started again here. And there are some comments, remarks in the Q&A section here. And Nigel Lewis has a comment about discipline in a hierarchy and using discipline procedures for people who don't adhere to the higher steps. And that's certainly an important part of human resources management, is having negative consequences for undesired behavior. One of the ideas of systems thinking is to think about, if someone isn't doing what we expect them to do, why might that be? And are there opportunities for us to have been better communicators, to have understood their motivations better, to have made it easier for them, or have made it so that they feel it is to their advantage to engage in the behavior that we want? And certainly for willful violations, then appropriate discipline is appropriate. But oftentimes, if we look underneath that behavior, we can find ways to encourage positive behavior without punishment, but not always. Ioana has a comment about talking about the benefit of risks, incorporating a risk-benefit analysis into the procedures, and acknowledge the benefit of going into a dynamic environment and either taking a risk or avoiding them at all. Well, going into the mountains has inherent risk, and we do it recognizing that there is risk. And some people will say that most people in at least in some countries live their whole lives perhaps not taking enough risks in their own evaluation towards the end of their life. So there certainly is benefit to taking risks, and all of us who have devoted our lives and careers to traveling in the mountains and doing other adventuresome activities recognize that. I think the point of risk management is to reduce risks so far as is reasonably practicable, but without diminishing the programmatic outcomes of the enterprise. So the best way to have no risks in the mountains is to never leave never go into the mountains and never leave home. But that's not an option. We're going to take some risks of going into the mountains and traveling in avalanche terrain, being exposed to severe weather and steep slopes and stoves that may burn us, and all those kinds of things. So it's really important to have a risk-benefit analysis, and different cultures do that differently. South Korea and Singapore are fairly risk averse, and whereas other countries like India, if people get hurt, there's a little bit less of a concern oftentimes. And so looking at cultural perspectives around risk and benefit is important as well. And Johan, you've asked, what about personal responsibility? And personal responsibility is important, and it's also important to look at systemic factors that support appropriate behavior or not. So there's a whole lot more that could be said about that, but let me leave it there. And that's certainly a topic that could be a webinar in itself. Should clients, Castro is asking, should clients be asked for their previous history to assess performance of a specific technical activity, or should it be trusted by the experience? What's interesting about experience is that research indicates that extensive experience does not improve judgment. And this has been shown to be the case across multiple industries, from call centers that Google has run to nursing. So just finding experience doesn't mean that a person is going to exhibit positive safety behaviors. In general, it's a good idea to verify qualifications and experience. I think there's more of a trend as the industry is professionalizing to do a more consistent job of evaluating people's capacities. And when it's clients or participants, medical screening is increasingly becoming valued and important? Would you take somebody who's 6 months pregnant up in the mountains, and why or why not? Would you take someone who has an active seizure disorder in the mountains, why or why not? What if they've had a seizure disorder and it's uncontrolled? What if their seizure disorder has been controlled by meds for the past 30 days or 90 days or 6 months? And how do you make those decisions? That's where medical screening can provide good supports. And Omri is talking about tourists who come to Mount Kilimanjaro who are old and have breathing symptoms. And if they have COPD, then what happened? We find the fitness comments while people are not fit. Is it the influence? I think trying to interpret what you're saying, Omri, Kilimanjaro is a fairly high elevation at the top, and so people can have pulmonary problems like high altitude pulmonary edema. So it's important to, it's helpful to evaluate people's medical condition, and if they have chronic obstructive pulmonary disease, if they have influenza, if they're on supplemental oxygen, then they may not be the best fit to go all the way up to the summit, but that's where medical screening and the use of physician medical advisors can be appropriate. That's a whole more detailed subject, but doing a medical evaluation in higher risk environments like high altitude, like at the top of Mount Kilimanjaro, is a useful thing. Let's see. Mark is saying the hot topic in the UK at the moment is profiling. Mark, if you're able to say more about what profiling means, that that might be helpful. Julian is saying with regards to values, I talk about the value of teamwork, and yeah, so that's wonderful. Thank you, Julian. That's really helpful. Okay. Let's carry on with the presentation. Then if we have more time at the end, we can consider more remarks and comments. So let's talk about these risk management instruments. And there are 11 of them, and we'll go through them quite briefly here. Risk transfer refers to transferring risk to an insurance company in exchange for payment of a premium. And this is liability insurance or other types of insurance. Transferring risk to participants in the form of an assumption of risk and release of liability or other waiver form. And then also sometimes transferring risk to providers or suppliers or subcontractors. So that's something that's a tool to consider. Incident management refers to having a plan and practicing that plan for what to do in emergencies, and practicing different scenarios and practicing again and again every year or every season, doing an emergency drill to stress test your emergency plan. Often emergency response plans will have two components: one for the field leaders that indicate what to do in the field, control the scene, perform first aid, contact emergency services, begin evacuation, and so on. And then a separate emergency response plan for administrators about liaise with search and rescue, contact families of participants, maybe engage with the lawyer and the insurance company, and so on and so forth. If it's a critical incident like a fatality, the response plan may involve years or decades of engaging with next of kin, for example, through annual memorial ceremonies and remembrances. The plan should be reviewed from time to time, for example, annually, improved as necessary, and then formally approved by management or whoever is in charge. Incident reporting refers to documenting mishaps and near misses when they occur, and then systematically analyzing incidents individually and in the aggregate to understand if there are trends and patterns, and then taking action based on the information that has gathered. It's important to have a culture where people aren't penalized for saying in writing, hey, I made a mistake and this happened, but people are encouraged to document incidents. And Omri is asking, is it possible to get the slides? And yes, they are available. And I put that in the chat earlier, and I'll put that, and Kaylin looks like is answering that as well. Thank you, Kaylin. Incident reviews refers to after a major incident, doing a formal evaluation of why might this incident have occurred, or what were contributing factors, and more importantly, how do we prevent this incident or a similar incident from recurring? These can be done by an internal team of reviewers or by external specialists. Typically, a written report is created, and then the organization has a responsibility to follow up on the recommendations in that report. A risk management committee is more of a North American safety concept, in my view, than something that's really common in Europe or in Oceania. But the benefit of having a risk management committee is that a risk management committee in this construct has external members who are not part of the organization, not employed by the organization. And so they are psychologically and financially more free to say, hey, I think this is an issue and I think the organization should address this. Their paycheck doesn't depend on pleasing the boss at the organization because they're an independent person, similar to a technical advisor or technical expert. They're not employed by the organization. So they can give more candid advice, and they're more likely to bring valuable external viewpoints to the organization. Medical screening, as we've talked about, refers to helping ensure that staff and participants both are medically well suited for the activity. And this can involve a health history form, potentially a medical screening manual, especially for remote, rigorous, and extended expeditions and excursions, and follow-up forms and questionnaires potentially. And then this information is passed to activity leaders, and then people are approved or medically rejected or conditionally approved for participation. And this can get fairly complicated depending on the rigor and the challenges and the remoteness of expeditions. You can see an excerpt from a screening manual that talks about heart disease and when someone would be screened in and screened out for heart disease. Medical risks in the mountains include things like sickle cell trait. Someone can have a sickle cell crisis at altitude. If someone's taking a medication that makes them more susceptible to solar exposure, then that's important to be aware of. If somebody has a history of frostbite or has a pulmonary infection and you're going to altitude or to cold environments, it's important to understand those in advance so you are equipped to act accordingly. A risk management review is a proactive safety audit of an organization's safety measures. And this is different from an incident review, which happens only after a major incident. Risk management reviews can happen every so often, maybe every couple of years. The organization stops, pauses, and says, okay, are we the best we can be in terms of safety and quality? And the risk management review can be done internally by an internal team, or external specialists can come in and provide this service. Media relations refers to helping ensure that if a newsworthy incident occurs, the organization is well prepared to liaise with news media representatives and to help ensure that the news story fairly and accurately represents the organization in an appropriately positive light. Being interviewed by news media personnel is a learned skill that improves with training and practice, and there are a variety of interview traps and pitfalls that training can help people learn how to avoid, so that you can put the organization's best foot forward and have an appropriately positive and accurate story about your organization and the incident be promulgated in the media. It's also important to restrict who is authorized to talk with media representatives. So ideally, the only person or persons who do so are charismatic, articulate leaders in the organization who have some training in news media relations. Documentation refers to durably recording what should be done and what has been done. What should be done can be documented in a risk management plan or safety management system document, SOP, operating manuals, field handbooks, and the like. Documentation of what has been done could be in an excursion log or a SOAP note form or an incident report form. And this is useful because it helps us understand what we should do and provide evidence to others if there's an incident or a question that, in fact, yes, we did the appropriate thing. Most of us didn't get into being in the mountains because of an abiding love for paperwork. However, good documentation is important to support good safety outcomes in the mountain leading context. Accreditation refers to recognition by a third party that an organization has met published good practice standards. There are very few organizations that provide accreditation services for mountain entities. The Association for Experiential Education provides a well-developed accreditation program for experiential adventure education programs. Veristar has an adventure safety accreditation service for mountain guiding programs in the USA. The American Mountain Guides Association provides that kind of service. And there are a variety of options, but they are pretty limited for organizations. And let's see. I don't think I have the option to provide detailed information and links to everybody about how to access those accreditation services, but you can look for that online and find those accreditation options. The last risk management instrument is Seeing Systems. We've talked about this a little bit. This refers to helping recognizing that when incidents occur, major incidents typically occur because of a combination of risk factors that combine in ways that we may not be able to predict in advance. And so rather than treating individual risks in isolation, for example, on a risk register or a probabilistic risk assessment, and assuming that that's all we need to do for risk management, and using risk assessments are important, but they are not the only or the primary tool to support good safety outcomes. We can build a resilient safety system that's characterized by redundancy and additional capacity. So if there is an inevitable failure in the safety system, it doesn't lead to catastrophe. Systems thinking also reminds us to pay attention to the role of government authorities and industry associations, as well as individual operators or businesses in developing supports for good safety outcomes. So that's a very brief introduction to the risk domains model and these various risk domains. If you'd like to learn more, there's a textbook called Risk Management for Outdoor Programs. You may be able to get that from your library through interlibrary loan, or it's available for purchase. There's also a 40-hour online training course, also called Risk Management for Outdoor Programs, that takes place over a month and goes over all this in more detail and allows participants to engage with the material and to apply it to their own situation. And UIMLA members and members of national associations can get 20% off this training by using the code UIMLA20 at courses.veristar.com. So as we're wrapping up here today, we have a little bit of time for comments and questions. And I would invite you moving forward to think about, are there 1 to 3 priorities that you can think of for your organization that you could take to support improvements of risk management in your mountain leading organization? And you can just do this in your head and think about 1 or 2 or 3 things. If you'd like a more structured way of doing this, at the link on your screen here, there's an online form that will walk you through a semi-structured process for thinking about what are the opportunities for improvement and which might be priorities for us. So those are some ideas at a fairly high level about risk management in the mountains and the factors that can lead to good safety outcomes for mountain leaders and mountain leading organizations around the world. I want to thank you very, very much for your time and your attention and for your remarks in the webinar chat and the Q&A. And we have a few minutes left for further comments or questions. And if you'd like to reach out to Veristar, you can do so at info@veristar.com or through veristar.com, as you see on the screen here. And let's see, I'm looking at the Q&A here. Julia is asking about a copy of an incident management form to look at. Well, there are when you say incident management form, I'm thinking, is that an incident report form? And we do have copies of that, or are you thinking about an emergency response plan, which is a little bit different? And if you email me, Julia, offline at info@virastar.com, I can provide you with resources for both of those. Also on the Virastar blog, we have examples of an incident report form that you can use, and UWIMLA member associations may have those as well. Matt Brown is giving a thumbs up to the power of good documentation. Thank you, Matt. Omari is saying that not everybody in Tanzania is following all this guidance, and that's understood. To some extent, risk management is a function of economics and resources, and places like Switzerland and Iceland can just frankly do more than many countries without the same economic resources. So we do the very best we can, and when we have international tourists coming in and from places where there might be really good risk management structures like in the UK, then engaging in informed consent and saying, hey, look, we don't have helicopters all over, we don't have paramedics, and it's going to take a while to get an ambulance here, or that kind of thing. That sort of informed consent is an important part of risk management in low resource communities. And Ian, you can have a question about answering questions in the Q&A if that's okay, and that's completely fine. Or Marion or Ian, if you want to call on people and unmute them, that's okay as well in the 5 or so minutes we have remaining.
It looks like people are saying thank you, sending positive messages to you, Jeff.
Well, thank you for your time and attention, and you may be able to get CPD credits for this. You can talk to management at your national association to see if that's possible. And also thanks to Ian and to Marion and to Daniela and to the leadership of the entire executive committee of the board at UWIMLA for making this presentation possible.
Yeah, I think what you do in Virastar is quite amazing, and I really enjoyed your course. And yeah, I hope you did a wonderful presentation, for today. And yeah, I hope people will be more curious to try to find more details on your website and to use the UWIMLA discount. That will be even better for everybody.
One of the things that I think about with risk management from a systems perspective is the value of established, high quality, well-developed standards. And most people are aware, I think, at this point that UWIMLA has just come out with a new set of standards, and that's one of the most powerful things that can be done to support quality safety outcomes in mountain leading is well-developed standards that are consistently applied and have a high quality training scheme that is built around those standards. So kudos to UWIMLA for its work, and to those who put in lots and lots of hours on a volunteer basis to establish the newest version of these standards.
Yeah, I've just shared an excerpt of the new UWIMLA standard for people who've joined us who haven't seen that document yet. It is available on the UWIMLA website, of course, but this is a new section on risk management and planning, and it really signals a direction that we expect the industry is moving in. So we need to make sure that everybody has these skills and this awareness. Hence this partnership that Marianne has worked with Jeff to produce for this training for you. Okay, well, I think that's bringing us towards a natural finish, isn't it? I'd like to thank Jeff particularly for a very tight, focused presentation there. overcoming the IT problems at the start there. That was yeah, it's always a bit of a white knuckle moment when things fail, isn't it? For everyone else, we've got another webinar coming up, not next week because frankly I'm traveling and we have a WIMLA board meeting, but the week after we have an outdoor active presentation. And then we have a presentation on the new WIMLA standard, which I really strongly think everybody should come along to. And after that, we'll have a medical presentation, but we're just struggling to find dates that work for that right now. There's been a lot of people requesting access to the recording, both for this and for previous. We are making those available on the Zoom platform itself, and the details have been sent in the last email that we sent you about webinars. They're at the bottom. So in a few days, you'll receive an email about the Outdoor Active webinar. And at the bottom, you'll have the link to this webinar again if you want to join. And just for interest, we see about another 100, 200 people who look at the webinars offline later. So that's proving to be very successful. Another question which I dealt with offline was that people want an attendance certificate. We will do those, but I just need to point out that the data processing involved in figuring out who attended and for how long is not trivial, and it will just take us a bit of time to come up with a method for doing that. So it will happen, it's just not in the next 24 hours. I think that's probably everything, is it, Marianne? I think I'm pretty happy at this point too.
Yeah, I have nothing,
Okay.
not too much to add to this. I think things are clear. Jeff made a great presentation, said everything about the next steps, and I'm just happy this took place finally.
Excellent. Right. Well, we'll bring that to a halt. And thank you very, very much. Thank you to everybody, and in particular Jeff, of course, for joining us. Thanks very much. Okay. Good night. Have a good week.
Thank you. Take care, everyone. Bye-bye.
Bye.
Thanks, Jeff.